Hello and welcome. My name is Lane, and today we are debating service delivery for transition age youth and adults. We will be debating the topic of empowerment versus care for the transition age youth and adults. While self-sufficiency for any person is very important, it's also important for these adults to receive some extra care. But where do we draw the line? Some individuals receiving the extra care are, in fact, just being told what to do and are having their choices decided for them. This is what we will be debating today. Where should that line be drawn? On the pro empowerment side, we have Angelica, Sierra, and Brianna. On the pro care side, we have Patrick, Sean, and Tabitha. The debate will begin with Angelica on the pro empowerment side. Angelica, would you like to begin?
Thank you, Lane. Although there are many transition age youth and adults who find themselves trapped in a system of care that are determined by others, there are services that support their choices and empower them to be independent. The pro empowerment side is advocating for more freedom of choice and options after high school, such as college or vocational training programs. We're supporting independence for individuals with disabilities post school. Some services that are offered are Centers for Independent Living, also known as CIL. According to Waymayer and Gregudas, the CIL is utilized to empower those with disabilities and to encourage autonomy. CIL offers many services such as job training, coaching, provides information, transition information, as well as promote independence, to name a few. The CIL plays an important role in supporting those with disabilities that are transitioning from secondary education to adulthood. Although there are plenty of services offered, we believe that individuals with disabilities should have the right to make their own choices and avoid guardianship. Having the ability to make your own choices, whether they may be easy or difficult as a young adult with disabilities, is an important component in independence and self-determination. With guardianship, it may be excessive and unnecessary and hinder an individual from making their own decisions, especially if they are capable. Another service that is offered is vocal rehabilitation, also known as VR. According to Martinez, the VR supports and provides individuals with disability trainings to develop, gain independent living skills, and overcome the need for guardianship. A meaningful and independent life is when individuals are given the opportunity to make their own life choices and without undue guardianships. Making your own choices is empowering. Those individuals that are doing so are better employed with salaries that are high and help them become more independent. Additionally, in order for those individuals with disabilities to thrive, we believe that family support is essential. As those individuals with disabilities mature, it is their family supporting them with their every need and decision until they are able to do so independently. Families provide the tools that are needed for them to learn, develop typically, and are there to guide them as well as help them participate in their daily routines. Individuals that make it to be independent have a lot of family support. Altogether, many services are offered in order to support their choices and empower independence. Individuals that have more freedom of choice and are aware of their options post school can set them up for success. With the proper guidance and support, these individuals can pursue their independence and utilize support where appropriate without guardianships that are not necessary. Thank you. And now I'd like to hand it over to Patrick, where he will be introducing the ProCare side.
Thank you, Angelica. Individuals with disabilities are one of the most susceptible populations in our country. They're a population that needs support put into place for the accomplishment of daily tasks, which are often taken for granted by the rest of society. These daily tasks include things such as bathing and grooming, assistance with purchasing food and cooking, and assistance during employment and in the environment where they can feel safe. And most importantly, having assistance to protect themselves from abusive situations. This population needs assistance, especially in the transitional period of early adulthood. Individuals with disabilities require many supports to make it through their day. Many of these individuals have mobility issues, don't understand stranger danger, and are at risk of safely interacting within environments without staff. A sizable percentage of this population are nonverbal and would not be able to call for help if they were in a catastrophic event such as a fire or a flood, or if someone was trying to do them harm. This is why having a staff or caretaker is needed for the majority of individuals with disabilities. Many individuals with disabilities find themselves victimized by others and need support to ensure no one takes advantage of them. According to Erica Harrell in 2016, the rate of violent victimizations against persons with disabilities was 2.5 times higher than an age-adjusted rate for persons without disabilities. While this is a terrifying statistic, there are other ways that members of this population are abused. The risk of financial abuse is high, and individuals with disabilities lack the understanding of the concept of money, which makes them prime targets for exploitation. Having support staff and caretakers that look out for them against abuse and financial exploitation is a necessity. Many individuals with disabilities cannot get themselves to a doctor when they're sick or take their medication on their own. Many individuals require specific medication that must be taken daily, sometimes multiple times a day. Remembering to take their medication may be essential for an individual's health and well-being, and assistance may be essential for some. Having support professionals that work with the individuals allow them to have the help that they may need to take the proper medication at the proper times. Daily hygiene, managing money, and going to the store are common daily tasks that people with disabilities have trouble doing routinely. Some individuals need help with preparing food and help with bathing and grooming so that they can go into their community with a sense of dignity. This can and is accomplished with trained support staff assisting this population. Community employment is not the right fit for all people. Some individuals with disabilities require supports that are not feasible and or practical in an outside working environment. Sheltered workshops provide support to individuals as needed and allow them the opportunity to make money and enjoy the camaraderie of working on a common task with other employees. Now I will hand it off to Sierra.
Thank you, Patrick. For the first key point on the pro side I'd like to prove is service, centers of independent living. CILs have proved transitioning individuals multiple opportunities to develop independence in several areas in an individual's life. CILs not only provide great learning opportunities, but have proven their effectiveness over the years. One CIL facility in metropolitan Detroit proved leadership, job readiness training, and paid volunteer and job experience for transition age students, Redmeyer and Gragudas, 2004. CILs have also created multiple opportunities for students in school. Back in 1990, Congress reauthorized IDEA, Individuals with Disabilities Education Act. It was at this time the CIL and the school system have collaborating allowed these individuals access to an education, including access to have IEPs, the individual education programs. When CILs and schools connected, it was allowed transitioning youths prepared for adulthood. Lastly, with everything CILs have to offer to those who qualify, have allowed these individuals to experience self-determination for themselves. Self-determination for anyone helps strive for success, and without CILs, these individuals may not have the opportunity to experience self-determination, which they have the right to have access to. While typically positioned as a movement toward independent living, one could quite easily argue that the real mission of CILs is to promote the self-determination of people with disabilities, Redmeyer and Gragudas, 2004. The next key point I'd like to address is the right to make own decisions and avoid guardianship. One study found that young adults with disabilities who took part in a program designed to increase their self-determination became better employed, were more independent and had greater access to their communities. Little et al., 2013. With this research of self-determination shows that individuals who have access to exercise this right prove to others and that they're able to make their decisions on their own without the constant supervision of parent or guardians. People with disabilities also have the right to express their opinions and thought processes, given that there will be instances where multiple parties are involved for certain events in a decision-making process. In addition to making decisions, individuals with disabilities have the right to a VR that help individuals prepare for employment, find comfort and security in the workplace. These services also allow the individual to practice individualism without worrying about guardianship overruling the decision-making process. Finally, the third key point I'd like to address is family support. Family support is crucial for any individual's treatment plan. However, that doesn't mean that the families don't feel the stress of a diagnosis of autism either. Upon hearing the child's diagnosis, one study found that parents felt 52% relieved, 43% felt grief and loss, 29% felt shock or surprise, and 10% of parents felt self-blame. Banich, Induance, Conway, and Kaus, 2010. Often parents are relieved that they were given an answer in regards to their child's symptoms, but that does not erase the stress that they endure while raising a child with autism. Hartman, 2012. As stated, 52% of parents felt relieved, which means of those parents, some felt in some way some form of hope for their child and have started the process of support for the individual. Including family means understanding the individual's needs and providing communication to all family members involved to ensure the best treatment possible. As mentioned before, it is important for the client to practice their individualism without overbearing family members, bombarding every idea and opinion without consideration of what the client may think. It's important for the client and family members to listen to one another. And family support means listening to the client's needs and understanding that it's okay to trust the client is aware of events happening during treatment. Family is inevitably going to be around during the treatment for the client and will have ideas and opinions which will be beneficial, especially if the client is seeking additional guidance and assistance. Seeking additional guidance and assistance through family support could also help the client exercise individualism by independently making these steps on their own. Independently seeking for family support proves even more that the client is capable of making decisions on their own. I will now hand it to Sean for the con side.
Thank you, Sierra. The first topic I'd like to address is 24-hour supervision. Individuals living with disabilities require many supports and services for day-to-day living in order to function appropriately in society. While few individuals may live relatively independent lives, it is far more common for individuals with disabilities to continue living with family well beyond when their typically developing peers commonly move out on their own. As found by Dudley et al., up to 60% of individuals with autism will continue to live with family, even those with average intellectual abilities. Another 30% live in residential facilities. Additional studies have examined individuals with ASD are far more likely to continue living at home as compared to individuals with other types of disabilities. Despite many services provided to all individuals with disabilities, it is clear that individuals with autism are statistically unlikely to ever live completely independently and will always require some type of support and supervision. Next topic I'll cover is neglect, abuse, and exploitation. Individuals with developmental disorders are often the target of abuse or neglect, as well as exploitation in many forms. They are often viewed as easy targets, as they may either not know they are being exploited or abused, or are unable to communicate that they are experiencing such troubles. According to the data from Weiss and Fardella, individuals with autism spectrum conditions were 30% more likely to experience physical abuse, 45% more likely to experience emotional bullying from coworkers, and 60% more likely to experience some form of sexual assault than their typically developing peers. study by Sullivan and Nitson looked at the abuse rates of individuals with developmental disabilities as compared to their peers. It found that individuals with disabilities experience abuse at a rate of about 3 times that of their typically developing peers. Because individuals with disabilities are at a higher risk for abuse or exploitation, it is in their best interest to continue to receive care and support well into adulthood. Next, we'll look at mandatory medical passes. Individuals who have received an autism spectrum disorder diagnosis are often diagnosed with one or more additional disorders. Many medications are required for these individuals to function from day to day. In a study by Buck et al., it was observed that 78% of the respondents take some type of medication. Of that, 58% were on some type of psychotropic medication, 35% were taking anticonvulsants, and 13% were taking some type of sedative. Additionally, a third of the study participants were taking at least 2 medications, a quarter were taking 3, and almost a fifth were taking 4 or more medications. With a high rate of medication requirements, it is imperative that these individuals are taking their medicine as and when prescribed. Nicolaitis et al. Also looked at many medical concerns for individuals with developmental disabilities and found that there were a multitude of comorbid diagnoses. These included chronic medical illness, gastrointestinal disorders, and feeding and nutritional problems. Specialized diets will often require assistance in purchasing the food, preparing it, and ensuring that mealtimes occur regularly. Now I'd like to discuss assistance with daily tasks. In a given day, everyone has many responsibilities and personal care activities that must take place between food preparation, daily hygiene, setting up and keeping appointments, and managing finances. There's a lot to be done in a given day. Turcotte et al. Found that adults with autism experience a significant drop-off of daily skills therapy post-transition, many of which are essential in the development of social communication and interacting with others. One-to-one support, occupational therapy, and social skills trainings are major therapies and skills that adults with autism need support with, though fewer than 25% of adults receive these therapies. Individuals are not receiving these therapies and lack many daily skills. They will require additional supports throughout adulthood, which can be provided with lifelong care. Adults with disabilities often struggle in many responsibilities and as a result require additional assistance. Cheek, Zamora et al. Looked into the feelings of transition-aged individuals with autism spectrum disorder diagnosis and found that they believed adulthood meant managing one's own finances, believing themselves unprepared to handle their own money, and were too concerned with that they would be at risk for exploitation without a better understanding of finances. Individuals with disabilities may never fully feel comfortable handling these responsibilities and will require someone to look after them well into adulthood. Finally, I'd like to discuss non-integrated sheltered workshops. Individuals with developmental disabilities are typically unable to obtain and maintain working employment in the wider scope of society. As individuals transition into adulthood, maintaining employment is a crucial step towards independence. Because of the many functional skills that individuals with autism lack, it can be very difficult to obtain and maintain employment. Working in sheltered workshops allows for meaningful employment, structured routine that can be practiced, mastered, and developed, and the development of working skills that could lead to future employment outside of the workshops. General employment is difficult for individuals with autism. It is difficult for them to maintain employment. According to Westbrook et al., studies have shown the most common cause of individuals losing employment is a result of behavioral and social problems. Workshops are designed to better accommodate such behavioral issues and can assist employees as needed. Thank you, and I'd like to now pass it over to Brianna.
Although skill repertoires vary across individuals with disabilities, and some require additional assistance, such as with daily tasks or more complex tasks, such as financial planning, 24-hour supervision does not provide adults with disabilities opportunities to practice skills that will contribute to expanding their repertoires. Limiting individuals hinders their freedom to live independently inhibits their autonomy, and places barriers on their self-growth. As behavior analysts, we must follow the BACB ethical codes. Under Code 2.09b, it is the responsibility of the behavior analyst to recommend an appropriate amount of services and oversight for the client. Unless absolutely necessary in extreme cases, 24-hour supervision of adults with disabilities is unethical as it not only creates limitations, which may lead to unintentional issues such as prompt dependency, but it is also the most restrictive method, thus violating Code 4.09 of using the least restrictive procedures. 24-hour supervision brings up the discussion of costs versus benefits, as it would be expensive for a client or clinic to pay for staff that is available 24 hours a day, may lead to staff burnout, high rates of turnover, which would restrict the successes of the client. Next is abuse, neglect, and exploitation. The population we work with are vulnerable to unwanted exploitation, such as bullying or abuse. As service providers, it is our job to provide the support and care to ensure safety in the lives of our clients. ABA program interventions can be implemented to raise awareness about recognizing unsafe situations, as well as how to appropriately respond, how to get help, and from who to get help from. An example of a hypothetical treatment program would include the purpose, objective, mastery, maintenance, and generalization criteria, as well as a list of targets. The targets would vary depending on the client's repertoires, but would include targets that range in difficulty to build understanding. Apart from this, frequent body checks for clients with limited communication skills at doctor checkups or with authorized caregivers will ensure visible marks on the body are accounted for possible physical abuse. Implementing an antecedent strategy similar to an ABA intervention creates awareness and education for the client, and frequent checks for signs of abuse ensure the client is cared for. Having these hard conversations with caregivers and clients will benefit them by having open communication about unfortunate possibilities and allows for trust and support that they need. Next is medical passes. For clients with medical needs requiring prescriptions, visual schedules and medication pill boxes labeled for pills per day can be useful for maintaining intake consistency and serve as reminders. One example can be a pill medication box which labels the weekdays in order as well as divides each day with time such as morning, evening, or night. Another example could be a medication schedule which would include the pill, when it was taken, and what the pill is for. Pills can be organized by the client if the capacity allows, by primary caretakers, or the pharmacist at the time of prescription pickup. Communication with primary physicians about potential side effects should be discussed in order to weigh costs versus benefits and create awareness for what to expect and what should be immediately communicated with doctors, which covers Ethical Code 2.03 of consultations with other providers as needed. Medications should begin at low doses so that risks are limited and then move up in dosage as necessary when benefits have been accounted for. Next is assistance with daily tasks. Before adults are expected to live independently and care for themselves in areas of hygiene, finances, and shopping, they can learn to do so through ABA-style strategies and interventions. Visual schedules can be made for needed areas, which have been backed by research evidence to be effective. Visual schedules are to be individualized in order to best fit the client's needs based on their repertoires, areas of need, and amount of need. For example, visual aids can be specific to the tasks, steps in bathing, or broad, highlighting daily routines from breakfast to bedtime. Fluency with daily living and vocational skills leads to autonomy and increases independence, so they should not be limited or assumed to require assistance throughout their lives. According to Taylor, Smith, and Malik, adults with ASD who are in vocational placements with a greater degree of independence have greater reductions in autism symptoms and maladaptive behaviors. Their study also showed greater independence in daily living skills. Thank you so much. I will now pass it over to Tabitha.
Out there for individuals with disabilities, but some of those services aren't appropriate for all of those individuals. Many individuals who are on the spectrum have been found ineligible or denied services like VR due to their disability being less severe when compared with other disability groups. Even if they do enter the system and gain employment, they are still found to be working less hours and earning less wages than other disability groups. This is why places like non-integrated sheltered workshops are a lifeline for individuals with disabilities, as they allow them to earn money in a safe environment. On the subject of the right to make own decisions and avoid guardianship. Yes, independence, especially when it comes to individuals with disabilities, should be promoted, but at times it's hard for individuals with disabilities to make decisions that affect their lives long term, so the answer is appointing a guardian. When someone appoints a guardian, that means that the guardian can make the critical decisions of where the individual lives, with whom they associate with, which doctors to see, questions regarding major medical decisions, etc. Our guardian can be a parent, relative, caregiver, etc. Guardianship does not necessarily take away an individual's independence, as they can still have a say in different matters, but it does help when an individual does not have the intellectual ability to make those hard decisions. And on the subject of family support, as has been stated before, family support is crucial for one's treatment plan, but there are a few things that hinder said support. When it comes to parenting a child with disabilities, there is a lot of stress, and according to SPCE, the divorce rate is 70%, whereas normal general population divorce rate is only at 50%. Along with high divorce rates, there is also a high rate of mental health problems among parents of children with disabilities. With high divorce rates and mental health problems, one can deduce that there are some children with disabilities that are coming from broken homes, and that family support may as well be non-existent, which means that for some individuals with disabilities, outside assistance may be crucial. And now I will hand it over to Angelica.
Thank you, Tabitha. As we all know, there are many services offered out there for individuals with disabilities. Although it was stated that some services were not appropriate for individuals, nonetheless, there are services that support these individuals to make their own choices, as well as empower them to be independent. Even though they are working less hours or earning less wages than other disability groups, regardless, they are partaking in independence by having the opportunity to work and be employed. It is true that individuals with disabilities have the right to make their own choices, but we also need to take into consideration that even though it is hard to make decisions that affect their lives long term, they should have the option and opportunity to have a say in what is happening in their lives post school. As for guardianship, it may be true that it doesn't take away from their independence, but again, they should have the right to make decisions without guardians overstepping during the decision-making process. Which leads me to family support. Although family support is the foundation of success, Tabitha made a good point about families who are broken and cannot provide the means to support their child on a consistent basis. So looking into other resources can be helpful. Although there are differences in family dynamics, they still have the means to be supported by their families, but in their own ways. Now for Patrick.
While there may be evidence that 24-hour supports can be the cause of prompt dependency, and it is costly, we still contend that there are circumstances that require 24-hour supports for individuals with disabilities, severe enough that they cannot be left alone for their own safety. We will concede that individuals that need 24-hour supports will have moderate to severe disabilities. This is especially evident in the case of abuse, neglect, and exploitation. An individual with moderate to severe disabilities may not have the mental capability or mental capacity to understand or mobility to get away from a person taking advantage of them physically, sexually, or financially. As for medical supports, we are willing to concede that there are many ways to help individuals sort and deliver their own medication. But we contend that individuals, especially those who need physical assistance with mobility, have an absolute need of care. Those that do not have the capacity to open a pill bottle or a pill box will need the care of staff to hand them their medication. Also, individuals that don't have the mental capacity to understand how important it is to take their medication will need a support person there to provide the medication to them. As for supports with daily tasks, we will concede that there are individuals that could make use of a checklist that would help them remember to do certain tasks such as bathing and grooming in the mornings before they begin their day. Our concern lies with those individuals who do not have the physical ability to put themselves in a shower or a bathtub or to dress themselves or make their own meals. Those individuals will still need a staff person or a family member to assist them. Finally, employment. We believe all individuals with disabilities should have the opportunity to have employment in the community. But we also believe that for some of these people, this is not realistic. Whether the individual does not have the mental capacity to hold a job or the physical ability to do the job, there are circumstances that do not allow for everyone to have a job in the community. An alternative for this situation is a sheltered workshop, where there are many staff to assist the individuals with paid work that they can do.
All right, thank you guys for that debate. We're going to go ahead and move on to the question and answer portion of the debate. I will first ask, how does your topic approach the core ethical principles?
So I'll take this one, Lane. This topic approaches the core ethical principles in multiple ways. A common factor that empowerment and care both have relate to Code 2.09, the right to effective treatment. Many clients come to ABA centers, CILs, and other treatment facilities to receive treatment. When a client is seeking treatment, the facility then must follow the Ethics Code 2.01, accepting clients. Facilities are not able to refuse services based on sex, race, ethnicity, etc. If an event occurs where a client chooses to discontinue the service, they do have the right to do so as well. Ethics Code 2.15. It is important to remember that each client has different treatment requirements that are specifically designed for their own efficiency. For example, some clients may benefit from empowerment services while other clients may benefit from care facilities, and in some instances, clients may have success from treatments in both empowerment and care at the same time, otherwise known as involving third parties for client treatment, Code 2.04. Whatever those clients chooses, these core principles are set in place to ensure a safe and ethical treatment plan, regardless of the treatment, if the treatment is through empowerment or care.
Thank you, Sean. Our next question that we have is, why is this important to the field of ABA and the interventions?
Take this one, Angelica. The debate between empowerment versus care for individuals with intellectual and developmental disabilities shows strengths and weaknesses on both sides. The end point that can be taken is that people with disabilities need both independence and assistance. There needs to be a blend of both care and empowerment. Once a good system of care is in place, empowerment can actually be enhanced, and bit by bit, care can be decreased. This translates to the field of ABA by practitioners understanding that the interventions that they prescribe to their clients need to take both sides of the discussion into account. The practitioner needs to set up interventions to address specific needs for the individual and help them gain more empowerment and need less care.
The last question that we have is, how does consideration of this topic enhance practice and or address current issues?
Thank you, Tabitha. I can go ahead and answer that. Although many clinics and service providers focus on or have a majority of younger clients, there remains a necessity of services across ages. It would be detrimental for a client's repertoire to have services stop after transitioning to adulthood. Likewise, sometimes the client may not have a diagnosis or referral to services until they have already entered adulthood. In order to abide by Ethical Code 1.05D, clients may not be discriminated against because of age. They have a right to treatment that serve in their best interest. Along with the current issues brought up within this topic, it also affects behavior analysts' practice in terms of competence and experience. Limiting clientele to a certain age group or sample within the population they work with inhibits their own professional repertoire. If they are not contacting a broad range or diverse set of clients, they are ethically not able to serve potential new clients, as working outside the area of competence would violate Ethical Code 1.02. If they do contact enough experience to work on drug therapy or treatment planning, they are likely to struggle more as they would still lack vital experience.
All right. Thank you guys for that debate. That was excellent. Once again, my name is Lane, and I want to thank Tabitha, Sean, Patrick, Angelica, Sierra, and Brianna for this debate. We will end our debate with our resources.